Hello, everyone. My name is Jonah Wiley, and we are going to be doing a community problem framework video presentation. The assignment is to show my ability to understand a community, assessing the community, and assess a community slash social problem that they experience. So I'm going to be talking about, well, first, let's just identify the community. The framework task one, which is identifying the community. Defining the community. The community is focused on Recovery Unplugged treatment facility located in Brentwood, Tennessee. Recovery Unplugged serves individuals dealing with um, substance use disorders, offering a unique blend of traditional therapeutic approaches and music-based treatment. The community encompasses both the clients undergoing treatment and the staff supporting their recovery. So Recovery Unplugged isn't your traditional recovery facility. We implement music-based treatment, meaning that some clients that have a hard time with traditional means of therapy that can't normally express themselves, they use music and art to express themselves. We're going to talk about the community dimensions and functions. So, the recovery function of it, the primary function of this community is to support people in their journey toward recovery from substance use. This includes providing therapeutic services such as counseling, detox programs, inpatient and outpatient care, and the signature music therapy treatment that makes Recovery Unplugged stand out. Supportive environment includes the support structured environment where clients can share those experiences, receive guidance, and build resilience. Recovery Unplugged creates a nurturing space where healing is achieved through clinical care and emotional expression, with music playing a central role in that recovery. So let's talk about the population of it. The community served by Recovery Unplugged includes people struggling with substance use, often ranging in the age of late teens, so like maybe 18, even 17 years old, adults to in their 50s or even older than that. Many clients may have co-occurring mental health disorders, which includes depression and anxiety. Clients typically come from a wide range of socioeconomic backgrounds as addiction impacts people from all walks of life. So the staff of it, the clinical staff includes social workers, therapists, counselors, medical personnel like nurses, nurse practitioners, nurse managers, and recovery coaches who are all key players in guiding clients through the recovery process. Peer mentors and those in long-term recovery also contribute in the community by offering personal insights and support to newer clients. So the community is wide ranged around Recovery Unplugged to help those clients get through their addiction. The geographical boundaries, Brentwood, Tennessee is located in Williamson County, part of the larger Nashville metro area. The area is the area is not closed off, but clients come from all over the region for Recovery Unplugged, even some from out of state. The culture of the community includes like the community creates a culture of healing, creativity, and mutual support. Music plays an essential role in this culture as clients are encouraged to express themselves through music and art, what helps break down emotional barriers and foster emotional release. Um, let's talk about framework task two. Let's talk about the data behind it. Community needs, issues, and problems. The Recovery Unplugged community in Brentwood, Tennessee, primarily addresses the needs of individuals struggling in substance use disorder. This includes like what we're talking about, the problem, substance use disorder. Um, one issue that I want to discuss is the opioid crisis. Tennessee, and like many other states, has been deeply affected by the opioid epidemic. In 2022, Tennessee had an opioid-related overdose death rate of 25.9 deaths per 100,000 people, according to the CDC. This reflects a high need for recovery services, particularly in communities like Brentwood, where residents might seek support for opioid addiction, as well as other substance uses, including alcohol and methamphetamine. Um, Another one I want to tackle is the access to treatment. Despite the high demand, access to comprehensive treatment options can be limited, particularly for individuals without insurance or adequate financial resources. Tennessee ranks 35th in the US for mental health care access, according to Mental Health America, which means that many residents struggle to find affordable and adequate care for substance use disorders. So think about it from this perspective. There's only 50 states in the United States, and the fact that Tennessee is ranked almost at the bottom half of it, a little maybe close in the middle, but still at the bottom. That says a lot to how some states, including Tennessee, see mental health and have access to mental health care. Framework Task 3, community assets, community values. The community served by Recovery Unplugged is centered around values that create healing, resilience, and creativity. Those key values include recovery and healing, creativity, and support and empathy. The primary focus of this community is on recovery from substance use disorder. The community values long-term sobriety and emotional well-being. A core part of Recovery Unplugged model is music therapy, which integrates creativity into the healing process. The belief in the power of music to help people express emotions, process trauma, and connect with others is a central value. So, what makes Recovery Unplugged stand out so much from other treatment facilities is the fact that they implement a music-based treatment to where some traditional means of therapy doesn't work for certain clients. Like some clients don't like sitting in a room talking to one person, expressing their emotions or laying their emotions all out on the table or whatnot. What makes Recovery Unplugged so special is that the music-based treatment part of it is that they use the music that they like and create to express themselves and their emotions, and that helps them get through every day and helps them improve their mental health as well as help with their substance use. Um, the community thrives on mutual support, empathy, and shared experiences. Both staff and clients value peer connections and the supportive relationships that emerge during recovery. So we see a lot of positive outcomes when it comes to those values every day at Recovery Unplugged. Strengths and resiliences. The Recovery Unplugged community has several strengths and forms of resilience and supports its members through in innovative treatment model and peer support. The integration of music therapy as a unique tool in addiction treatment helps individuals express emotions they may not able to articulate through traditional therapy alone. This creative approach provides emotional support, fostering resilience. Peer support, the community places a strong emphasis on peer support groups and recovery networks. Clients share experiences in the recovery journey. This sense of belonging promotes resilience. The power structure within Recovery Unplugged includes both formal and informal leaders. Formal leaders include the clinical staff, which are your therapists, social workers, and medical professionals like nurses, nurse practitioners. within the treatment center. They guide treatment plans, facilitate therapy sessions, and ensure clients receive necessary care. These professionals also help shape the recovery environment by creating a therapeutic and non-judgmental space. And then you also have your administrative, so like the directors and administrative staff. They are responsible for decision making, operations, and implementation of the treatment program. So we call them techs at Recovery Unplugged. So those techs are those ones that are walking around the facility every day, helping the clients with whatever they need, with trying to schedule or even finding those clients for the therapists to see for their sessions, gathering them around for lunch, just the daily operations around that makes Recovery Unplugged work from day to day. Oops, excuse me. Informal leaders include the peer mentors and the long-term clients. Individuals who have been in recovery for a longer period often assume informal leadership roles by supporting new clients. These mentors serve as role models and provide insight based on personal experience. Long-term clients are the individuals who further along in their recovery journey, and they can influence others through their experiences, serve as motivators for newer clients. So basically what that means is that the peer mentors and the long-term clients, those are the ones that still, in the treatment facility, but those are the people that are seen as veterans for the newer clients to, tell them about their experience, how they are getting through it every day at Recovery Unplugged, and to help them with their treatment. Then you have legislators, local representations such as Jack Johnson, Sam Whitson, and federal senators like Marsha Blackburn advocate for addiction treatment policies. Then you have your social policies, key policies like the Support Act and CARA, along with Medicaid expansion debates, impact access to services and funding for recovery programs. Framework task for destruction capacity. So the formal resources include like the detox sessions, inpatient outpatient programs, music therapy, counseling, medical care, and partnerships with local services. Informal resources include peer support networks, 12-step groups, family involvement, and informal peer mentorship. Patterns of influence include the clinical staff that are key influencers in treatment, while peer mentors and music therapy shape the recovery culture. Service delivery is client-centered, blending clinical, medical, and creative therapies. So framework task one, topic six is about gathering information from people within the community. So the client's perspective on the social problems, which is substance use disorder. Clients at Recovery Unplugged are likely to share insights into challenges they face related to addiction and recovery. Common themes might include one, which I would like to talk about, which is the addiction stigma. Clients may discuss how stigma around substance use disorder affects their ability to seek treatment, maintain employment, and reintegrate into society after recovery. Many may feel marginalized or judged by family, friends, or employers. So I had one client quote me on this and say, people still see me as an addict, even though I'm in recovery. It's hard to shake that label. Sometimes it feels like a barrier to starting fresh. So you have people that think like this when they are in getting help in treatment, because they feel as though that they still are seen as an addict by some people, and they don't want to be labeled as a addict. Um Sometimes they feel like that's a barrier and it stops them from starting fresh. And that's really much how the addiction stigma plays into people's minds. Staff members' perspective on needs and challenges. So I had conversations with social workers, therapists, and counselors at Recovery Unplugged that can provide insight into professional challenges they face while working with people with substance use disorder. Um, One key thing they talked about was the family involvement. Staff may emphasize the importance of involving family members in the recovery process and highlight the challenges families face in understanding addiction and providing proper support. Um, Talked to one of the therapists at the treatment facility, and they said, and I quote, family involvement can make a huge difference, but it's hard. A lot of families don't fully understand addiction, and there sometimes lacks a communication. So you have people that don't understand or begin to describe how someone with a substance use disorder can impact their family. And you have a lot of people that don't even understand or know what to do and how to help them, even if it's family. Framework task two, topic six. So a significant social problem that Recovery Unplugged faces is, of course, the substance use disorder, particularly in the opioid and alcohol addiction. This issue impacts not only the people struggling with addiction, but also their families and the broader community. So let's understand substance use disorder. It's a chronic relapsing condition characterized by the compulsive use of drugs or alcohol despite harmful consequences. It's not just about the physical dependence, but also involves behavioral, emotional, and psychological dimensions that require approaches and treatment. Research shows that addiction often coexists with other mental health conditions like anxiety, depression, and PTSD, which makes treatment that much more complicated. So it's not just the physical aspect of it, it also plays into the mental and the emotional part. And sometimes that with so much going on in the person that makes the treatment that much more complicated. So let's frame the social problem in framework task three. The social problem we are addressing is social substance use disorder, particularly focusing on opioid and alcohol addiction within the community. Um, so one of the factors that we want to talk about is the impact on individuals and family. Addiction affects not only just the individuals struggling with substance use, but also their families, leading to emotional strain, financial instability, and fractured relationships. Family members often feel helpless and overwhelmed, lacking adequate support and resources to cope. So it's impacting a lot of people in a lot of different ways, but mostly their families to where they feel so helpless that they feel like they're not even doing anything to help those family members that are struggling with those substance use disorders. So a working hypothesis I wanted to talk about that I came up with in the recovery unplugged community, addressing substance use disorder through a multifaceted approach that includes increased access to comprehensive treatment, enhanced aftercare programs, and community-based education initiatives will reduce the prevalence of addiction, lower relapse rates, and improve overall community health and well-being. So I think if we put more resources into understanding substance use disorders and how in the future we can help with that by insurance, like local events or awareness, providing that extra treatment and studying ways to counteract those people with substance use abuse disorders, enhancing aftercare programs like sober living, inpatient and outpatient care facilities, stuff like that. Um, I think even community-based education, like touching up and educating ourselves on what it really is, I think that will help and reduce the addiction part of it. It will lower relapse rates and overall help the community's health and well-being. And I just want to show three pictures of the Recovery Unplugged. The last picture is Brentwood, Tennessee as a whole. And these are the resources that I talked about from a data perspective. Um, Thank you for listening, and I hope you guys have a great day.